Now, sites are being prepared for a potential worst-case scenario as COVID-19 infections soar in Gauteng, mass burials. The province is on the brink of becoming the new epicentre of the pandemic in South Africa. Provincial Health MEC Dr. Bandile Masuku and officials from the Forensic Pathology Services visited an area reserved for COVID-19 burials in Tshwane today. The MEC joining us tonight via Skype. MEC, thank you for being with us. Reports are that more than 1 million grave sites are being prepared. Can you confirm that?
Good evening and good evening to your viewers. It's not really 1.5 million grave site. It's the available grave site in Gauteng in totality, including all the regions and districts. And this is part of the work that should be done when you are preparing a response for the pandemic. Part of it is an uncomfortable program, but it should be done so that we don't get to a problem when we require them. And it's not by any chance suggesting that we would be actually requiring, but it's an important thing that the land should be available in case that we actually require to use such.
Well, the number raises questions because, I mean, there's more than 500,000 cases right now in the entire world. So just for Gauteng, 1.5 million. And the talk has been that even at the worst, we're looking at hundreds of thousands of deaths, not more than 1 million in one province.
Agreed. That's why I'm saying to you that it's not about the actual number for the pandemic. It's about the availability of these grave sites across the province. So the number 1.5, it's what we can be able to do and provide for in case. But it's not like in a situation where we are saying that we would be using them anytime, but it's just to say that as a province, this is the amount of grave sites that we have.
Yeah. And the land that's being identified, who's involved? Is this government land? Exactly how does it work and what were you viewing today?
Usually, burial sites are actually a privy and a constitutional obligation of municipalities. Where we went today, we were with officials from the city of Tshwane who were actually showing us what they've been reporting in the command center on the parcels of land that belongs to them that would be used actually as burial sites. And it's a matter that I think it is uncomfortable personally and also as a clinician, but it's something that we should ascertain from the side of preparations that as a province we should have identified such actual spaces.
Yeah. It is uncomfortable. It's more, but I guess the last question on this is mass burials. That's the potential that we're preparing for. What does that mean when there are mass burials? How do people say goodbye to their loved ones? How does it work?
In other parts of the world where this was actually done, and when we have, it's like, it's going to be limited people that are allowed to a burial site. And it's also going to be there won't be one single identification in terms of a headstone or something like that to identify the person. It will be one headstone that identifies all of them. And this is just what we have actually seen in New York, that what we have seen in Italy. And we are clear that as the government, we are not in a real sense expecting that to happen. But in any eventuality, we should be able to be having all the protocols ready in that regard.
MEC, talking about preparations, we know that Gauteng is going to take over the Western Cape, become the epicentre. You've acknowledged that. The National Health Minister has acknowledged that. We spoke to a health expert who's been watching preparations tonight, saying that the Nasrec site, for example, in Gauteng, that was announced with much fanfare, isn't ready, doesn't have ventilators, doesn't have oxygen, doesn't have the staff members required there. Can we start with that facility? What's going on in terms of readiness?
I think we're clear. Maybe the expert didn't understand what we're saying when we spoke about that it's an isolation and quarantine facility. And it's only now we have started the phase that deals of putting up hospital beds. And we have said and we have been on record saying that the beds that we are preparing are beds that will have capacity to give oxygen, that will also give an element of building on it when required, escalate the treatment when required. So the current facility as it stands, the first phase, which we said it very clearly that it's the isolation and quarantine facility, and the field hospital part of Nasrec is actually being prepared as we speak, and it will have those amenities.
And when will that be done, since the surge is here?
It will be done by next week, Friday. The first 500 beds will be done, and the next 500 will be done by end of July. And it's not only Nasrec that we are preparing other actual field hospitals in the part of the Ekurhuleni and also around the Midrand area.
Are we anywhere near prepared for what is coming, MEC?
I think I've responded to the question before to say that, sometimes this question is better responded to in a retrospective manner. But what we have put into place and what is there, gives us comfort that we'll be able to actually surf the wave or surf the peak. And it's a multiple and multifaceted preparation at different levels as we speak.
Yeah. Are you in support of some of the measures that officials are talking about, stricter enforcement of regulations in Gauteng, maybe even a harder lockdown in Gauteng?
I think the issue of the harder lockdown might not be an option because of the economic imperatives, but some of the regulations that have been put in place in different levels, like level 5 and level 4, would want to raise them up very sharply and say these ones that will give us maximum impact and effect in reducing the rate. Because in a sense that we know that this transmission of this virus is also actually related to increased movement and increased gatherings that we are seeing across the province.
Alcohol, is that a concern? What sort of engagements are happening between your department and National Health and National Government, for example?
The engagement has been clear that alcohol, there's not much benefit from it except what economists and people who are interested in the economy, that the tax we get there, we might be able to use it for other amenities for health. But in essence is that alcohol does drive a lot of wrongdoing. It also increases a lot of trauma, interpersonal or motor vehicle, which will then put a strain on our ICU and critical care, which at the moment would want to actually reserve them for those who are COVID positive.
Yeah. So as Gauteng residents, is this a possibility? We should prepare for those sales being blocked once more?
Yes, that's what we said when we spoke through the Premier as a Provincial Council, Executive Council, that would want to look at stricter regulations on the purchase and the utilization of alcohol, and would want to also implore that the enforcement of a curfew could help us to reduce a whole lot of movements. The interprovincial movement is also a big issue, which we are putting up as one of the options. So there are many other regulations that can give us maximum impact and maximum impact on reducing the rate of transmission.
All right. MEC, before we let you go, when will Gauteng's peak be as we become the epicenter? What is the modelling saying? How bad is it going to get, and how quickly?
And it's important that we actually say that if we look at the current rate of transmission, the peak might come very closer to around August, mid-August. And if we put more effort in reducing the rate, it can still be kept around September. So it is a function of what we put in place in terms of enforcing the regulation that will also push further away the peak, or also make sure that the system is actually ready for such eventuality of a peak.
All right, so pushing for some or return of some of those previous interventions. Thank you very much, Gauteng MEC for Health, Dr. Bandile Masuku. And that is where we end the full view. Thank you for being with us tonight from me and the team. A very good evening to you. Sports up next, and then, of course, Aldrin St. Pierre and African Perspective. Good night.